All right, Shawnee, we are live today. Can you tell me what you're doing?
Hey everybody, so what we're doing today is Stretchmarks Camouflage. We're actually going in, if you could see here, we're going directly into the stretch marks and infusing it with our vitamins and natural oils to produce collagen, elastin, and can't wait to see the results.
So now, what is this over here that you're using?
So that is my natural oils and also vitamins in there. What we're doing is we're literally, like I said earlier, infusing it directly into the stretch marks. So we're not touching the good skin, just the damaged, stretched out skin.
And how long does this process take?
Depends on the area. So with her, it'll take about an hour, hour and a half, because like I said, we literally have to go into the individual stretch marks.
Can you tell me more about how this process works? With the multiple steps of the process, can you tell me about it?
So today, this is her first session, so I like to call it my pre-treat session. Our goal is to do one and done. With her skin type and tone, it looks like her stretch marks aren't 2 shades lighter or anything like that. So hopefully we can get it done with just the pre-treat. But let's say in 30 days, because you'll see the results in 30 days for sure, if they're still lighter in tone, we can go in with ink. But of course, for everybody's sake, if I can avoid ink at all costs, I will. You know, I'm sure she doesn't want to sit here for an hour and a half either. So if we can do it all today, that would be fantastic. But we'll see results after 30 days. And we'll definitely have major improvement, probably about 70%.
So someone's asking about the red marks already. Can you tell us, is that areas that you treated?
Yes, so these we already did, of course. She's inflamed and we produced obviously trauma to the area. So watch out. She gets red really fast, so I'll do a spot. Let's pick a good one right here maybe. So watch, she's going to get super red very fast. So once she gets red, we obviously cannot go back on that. So I'll do maybe like 2 passes.
And someone's asking for the name of this procedure. What do we call this?
Stretchmarks Camouflage.
Exactly what we're
and
doing.
We do, yeah, that's exactly what we're doing.
Camouflage these stretch marks.
Exactly, is exactly what the name is, camouflage. But we also do scars as well. So with white scars, it's a different technique. If it's white, which is called hypopigmentation, we wouldn't do what I'm doing now with the stretch marks. You actually have to go in directly with ink. So after surgery, we can certainly camouflage the scars, and to have the complete makeover, we can tackle the stretch marks as well.
Yeah, and this is one of our many techniques for getting rid of scars. So a lot of people that do the nipple lift, gland removal from HG lipo, this can help them tremendously. You guys stay tuned. Follow us in our feed later. We are going to be posting some great before and afters. Someone's interested and wants info on this. If you are interested in this procedure, please DM us with your full name, phone number, and email address. Or you can email us appointments@jasonemermd.com. Someone's saying, is there ink like tattooing?
Yeah, so this is not ink. This is what I call the pre-treat first. So what we want to do is cause collagen elastin to produce on its own. But when she comes back, like I said, she should have a pretty significant stretch marks reduction. But if it's still lighter, we can determine if we need to go in with ink, or we can just do the pre-treatment again. But this method is perfect for ethnic clients, especially where we're prone to hyperpigmentation, where we don't want to put ink, in case, you get a little bit darker. So this will, like I said, cause collagen production and elastin to produce without even implanting any ink.
Will tanning affect the results?
Absolutely not, especially if we're doing the inkless method. But let's say someone does need ink. As you guys know, there's 2 layers of the skin, right? There's the epidermis and there's the dermal layer. So when you're implanting pigment, it goes down to the dermal layer. So when you tan, the only thing that tans is the epidermis. So you're not, the ink will tan with it. I get that question asked a lot, but this is the safest. See, now it's starting to get red, as you guys see.
Yeah, so for those of you that have been watching us for a while, on our live, you'll see this area was not red before, and now it is all red. It's going to start looking like this.
But this is only for a couple days, and then you guys will see the before and after. I do have some past clients. After 30 days, their results are phenomenal. So let's go ahead and continue.
Okay, here we go. And for the new viewers joining, can you explain what you are using?
I'm using some vitamins and natural oils, and it helps with healing, and it also obviously it helps with the collagen production. And by using my method, we're infusing it directly into the stretch marks, the individual stretch marks.
Someone just asked again, what is in the oil?
Well, vitamin E, vitamin C, vitamin A, and then some natural oils in there as well, and some essential oils.
Now, who is a good client for this?
Everybody. Anyone that has stretch marks.
Now, is this a painful procedure?
Why don't we ask our beautiful client here?
No.
So yes, this is not a painful procedure.
So on a scale of 1 to 10, 10 being...
It's like a 2.
A 2? Does it feel like... I mean, it's obviously not pleasant unless you like pain, but...
It's like relaxing.
Okay, so she says it's relaxing.
Okay. And is that a tattoo machine? This is a tattoo gun,
This
correct?
is a straight tattoo gun, yes. And then this is why also, if she needed ink, and you know, you're literally killing 2 birds with 1 stone, and we're gonna do some scar camo on her stomach later as well, with ink. So you guys stay tuned.
Stay tuned. Bye.
We're gonna go for a little bit longer, a few more questions. And this work for anyone that is pregnant is a good person.
Absolutely not. Do not touch anything if you're pregnant, please.
After pregnancy, if you have stretch marks, we can definitely help you out with those.
Yes, for sure.
We do a lot with mommy makeovers too. You can see a lot of great results we have there. We can remove the loose skin, tighten up, we can do internal heating, tummy tucks, a lot of great things there. And no, we are not going to make a tattoo on our patient today.
Yeah, you guys, like this is literally the perfecting session. So after your mommy makeovers, this is the last thing that you want to do. Let's get rid of all the stretch marks if it bothers you. Like I said, if we're doing ink, that should be the very, very, very last thing that you do.
Do stretch mark creams work, or is that a gimmick? Is one of our.
I don't think it's a gimmick per se, but you need something more aggressive to actually tackle the issue from, stretch marks is your skin being stretched out. So applying it topically, it's gonna be less effective than as if you're doing something like this. And then we do have, obviously, the aftercare afterwards where you can use those creams afterwards, but you need to cause some aggression like this.
Okay, so we're going to do one more pass. If you guys have any more questions, make sure to ask us because we are going to end soon.
But you guys should come in and see for yourselves. This is an amazing procedure.
Is this the best treatment for stretch marks? I've tried CO2 lasers and literally nothing else does work.
100%. This is the only thing, especially like I said, if this doesn't work as well, we can go in with ink to camouflage it. But this is the best, better than laser. I've had clients from all over the world travel saying that laser didn't work. So you can go on my Instagram and see, like people literally travel from Saudi Arabia. I've had Brazil, so people from other states.
What would be the best option to actually prevent them from happening? Someone's to prevent stretch marks from happening.
Oh, jeez. I don't think that you can prevent it. I mean, it just happens. Like, after, you can't prevent it if you're pregnant and your skin is stretched out, or if you're working out, and you just really can't.
Does cupping therapy work in tackling stretch marks?
No. Like, you guys, you have to literally go into the individual stretch marks and repair it. So that's what we're doing.
All right. Thank you guys for joining. We'll see you guys later. Make sure to stay tuned. We are going to post some great stuff in our feed.